It's a great pleasure to have you here. And of course, on behalf of my regional director, Dr. Hanan Bahi, I would like to thank all of you for being here, and especially also our partner organizations, UNU, UNEP, and HERA, of course, as was mentioned, in Europe, but also the government of Egypt for being with us here and playing an important part. So I understand that over the last 3 days, your discussions have reaffirmed the vital role of the collaborative surveillance in protecting public health. And we have seen that precision and surveillance grounded in timely, reliable, and actionable data is essential, not only for outbreak response, but also for policy development and prevention. And wastewater surveillance has emerged as a powerful tool within this framework, and building on its success in polio eradication and its rapid expansion, for example, during COVID-19, it now provides valuable insights for a range of public health threats, including influenza, hepatitis A, and antimicrobial resistance. By the way, all these infectious diseases matters are intensively discussed in this room, in this office, and in this region. As highlighted in your deliberations, detection alone is not enough. Surveillance must drive public health action. And as we move forward, it will be critical to, 1, clarify definitions and strengthen ethical and operational frameworks, 2, standardize methods and ensure comparability of data, and 3, integrate wastewater surveillance within national and regional systems. And I guess that alone is a lot of work already. Integrating the well-developed WHO-led polio program will be key to scaling wastewater environmental surveillance. WHO remains committed to working with countries, UNU, UNEP, HERA, and many others to advance these priorities and to ensure that wastewater surveillance becomes an integral and sustainable part of global and regional health security. Before we conclude, I would like to again express my sincere appreciation to our colleagues from UNU, UNEP, HERA, and others for your partnership and leadership in co-organizing this event, to all the national experts and participants for your kind contributions, and to the WHO teams, both at WHOEMRO and at AFRO, for their technical contributions and active engagement. And together, through joint research, technical cooperation, and global coordination, we can surely strengthen surveillance systems, protect communities, and save lives.